course, we have the cognitive functioning learning disorders. And most people don't think of this as mental illness, but it really is, because we often test individuals and we diagnose them with a mental retardation, with some borderline cognitive functioning. Maybe they have a learning disability at school that falls into the mental illness category as well. Some of them just have a really hard time at school and aren't able to function at all. And so we also look at them. And then there's the behavioral difficulties. ADHD, attention deficit hyperactivity disorder, falls into that. And that is someone who is unable to remain still. Let's say they're constantly fidgeting, they're in here and they have to do something, or someone who isn't able to pay attention. They're listening to me talk and now they're daydreaming already. They're daydreaming about something and then they've forgotten, or they haven't heard anything, or they're doing their math and they're making errors, just careless errors because they're not paying attention to it. They have poor impulse control. They don't stop to think before they do something. All of a sudden, they've already done something. All of a sudden, I'm already touching pachi over here and I don't realize it. All of a sudden, I'm standing up. And so those are the kids that's a diagnosis mostly with kids, because as adults, they may have learned to manage that behavior. But in the schools, we see a lot of kids who are very active, more so than the average child, and that would be where they would fall. Some of them certainly are, the behavioral difficulties are oppositional defiant disorder. It's a person who disobeys or does not follow the rules. And so the teacher says, okay, get out your book. Well, I'm not going to do what you say. You're not my mom. They're just very defiant at school. And then, of course, the conduct disorder is someone who takes it up a notch, who is stealing, doing all sorts of illegal activities, and that would give them the diagnosis of conduct disorder. Then we have communication disorders under mental illness as well. Someone who may have speech disorders, isn't able to articulate very well, has a hard time finding words to express themselves. We have childhood disorders, separation anxiety, kids who have a hard time separating from their parents, clingy, crying, selective mutism, kids who they at home they speak regularly, but at school they do not say a word at all, and they can go through the whole year not speaking to anybody and just nodding. Then we have the developmental disorders, kids who are autistic. Autistic kids are those who have very poor social skills, who may just look very odd, doesn't really want to play with anybody, doesn't make eye contact. They may have kind of like these kind of repetitive behaviors, rocking, self-stimulating behaviors. And then there are the thought disorders, folks who are schizophrenic, who may be seeing things, hearing things. The way that they speak with you is very tangential. They say something and it rambles and it goes into another topic and you can't really understand what they're saying. It doesn't make sense. Folks who have delusional disorders, maybe they believe that something is happening to them, like someone is spying on them, things like that. And then there are, of course, the chemical dependence area, and that certainly is a mental illness as well, too. Folks who are abusing alcohol and folks who are abusing opium, cocaine, marijuana, all of those things. Then we have the impulse control disorders, folks who are pathological gamblers, who are fire setters, and there's the eating disorders as well, folks who think they're too fat, and they binge and purge, or they starve themselves. And then the relational difficulties is just relationship difficulties, having problems getting along with others. And I went through all of this really quickly, and maybe some of you are like, oh yeah, I kind of have some of those. Oh yeah, I kind of have. That's okay, because it's okay to. There's the clinical, and then there's the within normal range. And within that normal range, you've got minimal symptoms to extreme symptoms, but it's still within the normal range, okay? So if you're like, oh, I checked my doorknob like 5 times, but that's okay. You don't have to worry about being OCD. It's just that there are the clinical piece, the clinical range, which means that if the behavior, the mood, some of these symptoms that I described is becoming so disruptive to your life that you cannot function. You cannot get out of the house, you cannot go to school, you cannot study, you cannot remain active as you typically have, then that's when it becomes concerning. And that's when we consider it a mental illness. But all of us need a little bit of OCD in us, otherwise we wouldn't have a clean house, right? All of us need a little bit of anxiety in us, otherwise we wouldn't be at work on time. So there's a little bit of all of these things that is healthy for us to have. For someone who says, nope, don't have that, don't have that, don't have that, they're probably just kind of like, oh, right? So we need a little bit of something to keep us moving. So I don't want you guys to worry about that. And that's important to keep in mind as we're thinking about the lyrics that we're writing, is how do you differentiate? How do you help the Hmong community differentiate between, oh, I need help. This is kind of getting a little bit over on the extreme side of the within normal range, or this is getting a little bit out of hand, I need to get help. Or, okay, calm down, you're okay. You just need to use a few strategies to help you cope with them. Okay, before I move on, I have an activity, and I'm glad I put it on there, otherwise I would have forgotten. Okay, so the first one is zhongxie. The second one is angry. What is angry? Okay, how about kind? Okay, greedy? Okay. Tedu, yep. Greedy, tedu is stingy, but greedy is shelo. Shelo. Someone who is very greedy wants everything for themselves. Shelo, it might be confused with shelo, and shelo is kind. So, or shelo is someone who has a big heart, and so sometimes that can get confused with folks who.
What is
Tedu is stingy.
Oh, okay.
Yeah, Tedu is stingy.
What's greedy in Hmong?
Greedy?
Greedy in Hmong?
Shahlu. If
Yeah,
you
shahlu,
say shahlu,
yeah, it's lu, shahlu. Okay. So then, extreme sadness, loneliness, yearning for the past.
I think it's food.
No, I'm glad you said that. Let's file that in the back of our mind, that word. What is someone who like, oh, they're just longing for the past, they're just yearning, oh, it's so sad. Tousaiko, right? Or what about kokosha? Kosha, right? Because you could kosha hang out that kind of thing. What no, that's very true too. We'll get to that later. What about worried? What is worried? Nyosha. What about secretive? What about motivated? What's the word for motivated? I'm so motivated to do something. When you think about it in Hmong. Yes, that's it. Moshia. Moshia, right? How about mean and cruel? Yes, shapei. How about short-tempered? Shalu. Yeah, shachindei. So what do you guys notice about all of these things? What do they have in common?
They're all lusha.
They're all lusha, right? Which means that, of course, the Hmong often see the liver as having an integral role in controlling our personality and our emotions. And that's so important to keep in mind, because it's not talking about the mind, is it? When we think about it in English, we think about feelings, but we also think about thoughts associated with it. Here, it's just all about the organ. The organ is controlling our emotions. And so we see that in the Hmong culture, the mind and the body isn't as interconnected. And that's going to be helpful for us to keep in mind as we start thinking about how mental illness is conceptualized in the Hmong culture versus the Western culture.